Have you ever walked into a room and suddenly forgotten why you went there? Or met someone familiar, only to completely blank out on their name? At first, we often laugh it off. Must be age catching up to me. But what if those moments of forgetfulness start happening more often? What if that blank feeling in your mind becomes more frequent? Then it may no longer be just normal aging. It might be the early signs of memory decline, whispers from your brain saying, "Pay attention." Growing older doesn't have to mean losing our memory. We can age and still stay sharp, independent and able to hold on to what matters. But only if we recognize the early warning signs and act in time. One of the most common early signs of memory decline is forgetting things that just happened. You might have just eaten breakfast, but a few minutes later you ask, "Did we eat yet?" Or you tell the same story over and over, not realizing you've already shared it. Loved ones might remind you, but the memory still doesn't return. This isn't just ordinary forgetfulness. It's a breakdown in short-term memory, the part of the brain that helps you retain recent information from just minutes ago. If you're frequently forgetting appointments, losing track of recent conversations, or needing to write down even the simplest tasks, it's time to pay attention. Don't brush it off. Think of it as your brain gently saying, "I'm struggling. Are you listening?" You're having a conversation and suddenly you can't find the right word. You know exactly what you want to say. The thought is there, but the word just disappears. Instead of saying refrigerator, you might say the cold box, the thing that stores food. Instead of bus, you say that big car, the one people ride together. This isn't stuttering or nervousness. It's a subtle sign that the language area of the brain is weakening. Language is not just a tool for communication, it's a major indicator of brain health. When the brain struggles to select the right word, it's showing a quiet, early signal of decline. If you often find yourself using roundabout descriptions instead of clear words, or if loved ones notice your speech seems off, take it seriously. Don't wait until language becomes clumsy to take action. You plan today so clearly. Morning checkup, afternoon visit with your grandchild, evening call with an old friend. But by the afternoon, you realize you missed your morning doctor's appointment, and by night, you completely forget to make that call, even though it was on your mind all morning. Forgetting little things now and then is normal. But if you're forgetting recent plans, especially ones that matter to you, it might be an early sign of short-term memory decline. Short-term memory is like your brain's scratch pad. It helps you manage daily tasks. When that pad starts failing, your routine becomes chaotic, even if your long-term memory still works just fine. If you find yourself needing to write everything down, setting multiple alarms, or feeling lost in time, don't ignore it. It might be your brain's way of asking for help. You used to cook every day. You knew the recipes by heart. But yesterday, while preparing dinner, you suddenly forgot what step came next. You stood there, looking at the ingredients, unsure how to begin. Or maybe you wanted to send your weekly email to a loved one. But today, you can't remember how to log in, even though you've done it 100 times. This isn't just normal aging, struggling with familiar daily tasks, especially ones you've mastered for years, may be a warning sign of cognitive decline. For those experiencing memory issues, performing sequences of actions, like cooking, driving, or using a phone, becomes difficult because the brain can't process order and logic as easily. If you notice yourself getting confused or disoriented midway through tasks, take the time to get a brain health checkup. Don't wait. Early awareness gives you a better chance at staying independent and in control. You wake up in the morning but can't figure out what day it is. You look out the window, see daylight, but mistakenly think it's afternoon. Or you're visiting a familiar grocery store, one you've been to countless times, yet suddenly you can't remember how to get home. Disorientation in time and space is a clear warning sign of memory decline. When the brain struggles to process timing, location, or sequences of events, you may feel like you're stuck in a time gap. Many older adults occasionally lose track of dates, but if you often don't know where you are or why you're there, it's time to pay close attention. In more severe cases, a person may get lost in their own neighborhood or fail to recognize the way home from just a few blocks away. Ask yourself, or observe a loved one, do you frequently mix up the days of the week? Do you forget why you're in a certain place? Have you felt lost in familiar surroundings? Don't dismiss it. Early detection helps protect long-term safety and quality of life. You used to be the one who kept things in order, planning vacations, managing the household budget, or cooking meals using familiar recipes. But now, you find following steps feels exhausting and confusing. A decline in the ability to organize or process logical steps is another warning sign of cognitive impairment in older adults. This often shows up in multi-step tasks such as paying bills, preparing a multi-course meal, managing a medication schedule. Following basic technical instructions, like using an ATM or rice cooker. You might take much longer to complete simple tasks, skip or forget steps while cooking, struggle to focus when reading instructions, feel overwhelmed and unsure in new situations. More importantly, you feel less confident doing things you used to handle easily. If you or a loved one is experiencing this, consider it a signal to consult with a healthcare provider early. In the past, you could easily navigate, remembering how to get home, knowing which turn led to the grocery store, or even finding your usual parking spot. But now, you might get lost on a familiar route or forget why you're in a certain place. This is one of the more noticeable and concerning signs of cognitive decline. Common signs include getting lost on familiar paths, forgetting the reason you went somewhere, losing your sense of direction in places like supermarkets or malls, struggling to understand simple maps or directions. Some people describe this feeling as being disconnected from space, like floating without an anchor. This isn't just frustrating. It can also be dangerous, especially if the person is driving or walking alone. Families should pay close attention if a loved one starts to avoid going out alone, acts withdrawn when traveling, or seems uncertain when asking for direction. Have you noticed someone in your family asking the same question repeatedly, even though you've already answered it clearly? Or maybe they tell the exact same story again and again, sometimes just minutes apart. This kind of repetition isn't just temporary forgetfulness. It's often a sign of short-term memory loss, a key feature of cognitive disorders like Alzheimer's. You might observe asking the same question 3-4 times in 10 minutes. Repeating a story they already told yesterday. Not remembering they just asked or heard the answer. Looking confused when you remind them they've already said it. While this behavior can sometimes be tiring for caregivers, it's not the person's fault. Their brain is no longer storing new information effectively, so repeating feels completely normal to them. Kind handling tip: respond calmly with patience. If needed, gently change the topic, or show visual cues like photos or notes to help them remember. One of the subtle but significant signs of memory decline is when an older adult begins to behave very differently from who they used to be. You might notice they become irritable or unusually suspicious, apathetic, disinterested in family or hobbies, anxious or panicked without clear reasons, or engage in odd behaviors, like wearing inappropriate clothes for the weather or placing objects in strange locations. These changes may stem from alterations in brain regions responsible for emotions and behavior. It's easy to brush this off as just old age. But in reality, this is often a red flag indicating the need for cognitive and memory screening. If you feel that your loved one is no longer themselves, don't ignore it. A simple evaluation could lead to early diagnosis, giving them the chance to live a fuller, healthier life. Thank you for watching until the end. If today's video gave you something valuable, a bit of knowledge, a gentle reminder, or a motivation to take better care of your health, then we've done our job. Please share this video with someone you care about. Sometimes, the right information at the right moment can truly change a life. And stay tuned for more helpful content on how to live healthier, longer, and with more peace of mind. Wishing you good health and many joyful days ahead.